Authorities in Macedonia say they're trying to confirm whether a British man who died in the capital, Skopje, had Ebola. The hotel where he was staying has been sealed off with another Briton and the hotel staff inside. They say the man's symptoms and the speed at which they developed led them to suspect Ebola. Simon McGregor-Wood reports.
Macedonian officials say the man arrived here on October the 2nd. He was 58 and soon fell ill. His condition deteriorated on Thursday and he died shortly after being admitted to hospital. His travelling companions say they had not been to a country affected by Ebola.
His colleague says he was complaining of stomach problems for the last 3 days. He refused to eat and was not communicating but didn't seek medical help. The hotel told the emergency department that he complained of vomiting and fatigue.
Authorities say they cannot yet confirm he had the virus. Samples have been sent to Germany where results are expected within 48 hours. His friend and the hotel where the two stayed are under quarantine. In London, the British government announced Ebola screening will now start, first at London's Heathrow and Gatwick airports and at the Eurostar train terminal. Travellers from Sierra Leone, Liberia and Guinea will be asked about recent travel, who they've been in contact with and their onward travel plans. Medical assessment could be given by trained staff on site. The government is responding to growing public fears about the spread of Ebola into Europe. Health officials have said it's almost inevitable, given the scale of the outbreak and people's ability to travel. The World Health Organization says over 3,800 people have died, out of 8,033 infected up to October the 5th. The global reaction to the outbreak is picking up pace. These American medics are among the many volunteers training to be deployed to the worst affected countries in West Africa.
I think with proper care we can get the mortality rate down to maybe 30%, and that's what I'm hoping for, because I'm not going over there to carry body bags.
In Spain, the first Ebola infection outside West Africa has been confirmed. The nurse in question remained in a Madrid hospital, but Spanish health workers have been complaining about their government's handling of the case and about their own safety.
We're demonstrating because from the beginning of this crisis, this situation happened because everything was poorly planned. You can't improvise, you can't dismantle a hospital and then want it to be cutting edge. You can't bring in second-class gear for a top-class situation. Most of us work in hospitals. I work in emergency. I want to treat patients, but I want guarantees when I'm treating them.
Health officials say that despite signs the virus is spreading out from its epicenter in West Africa, the chances of infection in Europe and elsewhere remain very low. But given the media coverage and the very nature of the disease, governments are aware they must do more to reassure nervous populations. Simon McGregor-Wood, Al Jazeera.